Good afternoon, everyone. Gareth Presh, founder of the World Health Innovation Summit. Absolutely delighted to welcome you to our afternoon session on a Friday, although it's early morning for Terry and Manasseh and Aubrey, who are joining us in the States. It's afternoon to Juliana in Berlin, and Suzanne is also in Germany. I'm going to start with very short introductions, and let's go stateside. Terry, can you kindly introduce yourself? We're going to discuss, by the way, patient empowerment and shared decision making today.
Yes, good morning, good afternoon, and Gareth, thanks for this forum this afternoon. My name's Terry Kuti. I'm the founder and director of the nonprofit organization Deep Sea Foundation. I established this foundation in 2016 after I had breast cancer twice and my own successful breast reconstruction. So we provide education and resources for patients in this space. So I really appreciate being on board this morning, Gareth. Thank you.
Thanks, Terry. And you're being very modest there. You have a wealth of experience, and we're looking forward to learning from yourself. Manasseh, can you kindly give us a short introduction?
Yeah, again, same here. Thanks a lot for the invitation. Honored to be here with you all. I'm a plastic surgeon in San Antonio, Texas. I specialize in breast cancer reconstruction. And as part of taking care of patients, I'm very interested in shared decision making, and that's really kind of been my philosophy and my practice, and has become another kind of area of focus for me. So that's why I'm here today. I'm eager to talk about that and patient empowerment, because it's all linked.
Fantastic, Manasseh. And Suzanne, absolutely delighted to meet you virtually. We haven't had the pleasure to meet in person yet, but I'm really excited to understand the work that you're doing, particularly with Siemens and some of the genomics work that you're leading on, you're pioneering on.
Yeah, thank you so much. And it's a real delight to be here with all of you. So my name is Suzanne Baars, and I'm the Global Senior Global Thought Leadership Manager for Siemens Healthineers at the global headquarters. Means I'm driving thought leadership across an organization of 70,000 people across 70 countries in the world. And I'm the founder and CEO of Social Genomics Moonshot. Everything I do has one goal, and that is to make personalized healthcare accessible and affordable for every human on the planet. I've seen the injustice when I was young, and that drives me to do everything possible, because although science and technologies are evolving, there's so much more that we can do.
Absolutely. And we'll really dive into that later as we get into the discussion. Aubrey, stateside, kindly introduce yourself.
Yes, thank you. And I'll echo the fellow panelists. Truly an honor to be with you this afternoon and this morning. Stateside, also on the West Coast. So for those of us early this morning, thank you for being here. Really excited to be part of this panel. I'm a pediatric cancer mom turned health tech entrepreneur, similar to Suzanne. I have just an appreciation of the pace of innovation in science and technology is happening at a far more rapid pace than the pace of adoption. And so it's a very simple supply chain issue that I think we can solve for. And, I would just kind of anchor that it needs to be measured in the context of how well are we engaging in shared decision making? How well are we putting the patient at the center? And when there are inefficiencies, I think we need to come back to just that root of understanding the individual patient preference and ensuring that everything that works around them is happening. There's mental health components, there's communication components, there's education components. But if we're aligned in terms of the measured impact, I think we can really make a difference.
Thanks a million, Aubrey. And Juliana, who's joined us in Germany.
Hi, hello, everyone. Thank you very much, Gareth, for inviting me, and hello to everyone that is watching. So I'm Juliana Scolani. I'm originally from Argentina, but I'm living in Germany now. And I work as a research manager at Solaviv, that is a preventative health company, that is developing digital solutions to empower people to live healthy and to increase their health literacy as well. So,
Fantastic. Thanks very much. And I know you've recently done some publications around cancer, and we'll also take a look at that later. Let's start off. Manas, could you give us a bit of an outline and explain what shared decision making is from your perspective as a physician?
Absolutely. So, during training, medicine is really, it's an apprenticeship, right? So during my training, I got to watch my consultants and mentors, as they were taking care of patients, and the patient, the interactions really between the physicians and patients. And it was very, back when I trained, it was very paternalistic. So basically the physician would just tell the patient what they should do. And so that's really how most of us have been trained, who are, my age and older. When I got into practice, I realized that there really is a lot more to giving patients information, a lot more than just telling them the procedure or making a recommendation or telling them about the risks. Shared decision-making is a concept really that isn't brand new. It's really standard of care. Unfortunately, it's not standard practice. What shared decision-making means is, instead of just telling the patient what you think they should do, a cookie cutter approach, what you do is you collaborate with the patient. And what becomes equally as important as your expertise is the patient's preference, their goals, where they are in their lives, their support structure, what's important to them, their values, their cultural background, anything that they consider is important for their treating team, for their healthcare team to take into account. That's what the healthcare team needs to consider. And so now, instead of a one-way paternalistic approach, what you have is you have this collaborative, two-way, equal contribution to coming up with the best treatment plan for that patient in their situation, their circumstance, and their preferences. So you could actually have twins with the same diagnosis, same genetics, same everything, but two different treatment plans because they completely have different goals, different preferences, different ideas. So that's what shared decision-making is. It puts the patient smack in the middle of the treatment planning, which is why they have to be empowered the right way, which is why we're here today.
Fantastic. And then from a patient's perspective, Terry, I mean, can you give us can you please explain to those viewing or who will be listening to this on playback, how important is it to be part of that shared decision process, and what's the impact in terms of quality of life and outcomes for the patient?
Well, the term shared decision-making, it has to begin with the education of the patient. As a trained ESL educator, we cannot expect any patient to use or act upon any term in healthcare unless we let them know what the actual term means. So I think that providing vocabulary, providing resources that actually teach a patient how to use and engage in shared decision-making is really at the core of my work. And I would like for shared decision-making, it is my dream to have that word be as common as, oh, I'm coming in for my appointment. I would like it to be a common term, not only with patients, but with professionals across all healthcare sectors. I'll see you at your shared decision-making consult in 2 weeks. Well, it just, I think it has to be that common of a term. I hear from patients when they actually are given these resources, I'll hear from them things like, thank you, because now I have all the questions I need to ask before I go to my consult. And you have to also allow them and tell them, you're sitting at the table with someone who's going to be changing your life, your healthcare for a very long-term time. So I think that we have to educate them with tools. We have to provide them in our communities. You know, these tools come in different forms. They come in the form of communication and talking about what shared decision making looks like. What is it that you can ask your healthcare provider? It's kind of the how to ask, what to ask, and then actually, you know, giving them the tools, whether it is through discussion in communities, whether it is through digital healthcare, and then giving them those tools to empower them to have these conversations and to feel very comfortable with it. I would add to this that I would like healthcare professionals to, you know, be as comfortable using this word and to know what it means and embrace it as, you know, we do for patients, because I think it is truly a collaborative effort. We have to sit at the table with each other, break down all those barriers that don't allow us to have these shared decision-making conversations.
Thanks. And just that leads us on very nicely to Aubrey. I mean, as a parent, I mean, we're all patients here. Your experience of shared decision making, you know, can it impact the patient? It'd be great to get an understanding from your perspective, and also as a mum.
Yeah, no, absolutely. And I couldn't agree more with Terry. And there's you know, there's a recognition, I think, that particularly when we're talking about cancer, that a cancer diagnosis is a traumatic experience, right? So appreciating that every single patient, it has a kickstart of the grieving process. They're initially going into that shock and denial. And so then the question is, how quickly can we move them through the grieving stages to move from shock and denial to acceptance, where they can actually take a more empowered stance? And there's certainly the relationship that the patient has with excuse me, with the oncologist, with the treating physicians, with the entire healthcare community. But there's also the recognition of the time that happens outside of that, and that's probably concentrated certainly in the pediatric setting, which is my story. I'll share that surrounding kind of circle of trust around that patient is so critical in the context of, is the right information actually, is the right community around that patient actually creating that nudge towards shared decision making. And so there's an opportunity for us to actually start conveying that same information, not just to the patient, but who they trust, how they actually communicate. Patients are already physically, emotionally compromised, and there's an opportunity to actually use that surrounding of trust to help empower that individual. I'm somewhat unique, again, in the pediatric setting. I actually was part of a clinical trial to help pediatric cancer moms through cognitive behavioral therapy, and help me as a caregiver get over my own trauma to ensure that I could actually start being the mom that I wanted to be and I needed to be during my son's successful battle with acute myeloid leukemia. And I think that recognition of the power of that cognitive behavioral therapy, the power of really focusing first on that mental health component so that we can be empowered, so that we can play the role that we want to play, is such a critical aspect in the context of patient-centered care.
Yeah, I couldn't agree more. I mean, it's a complex issue. I think when most people think of a patient, they think of the individual, but they don't necessarily think of the family, particularly with cancer diagnosis. You don't necessarily think of the wider impact in terms of the family, the grandparents. And that leads me, Suzanne, I mean, you're leading, you know, you're working with a very large multinational who are well established in this space, trying to influence, you know, positive care. You know, you're heavily involved in knowledge management. You understand the value of navigating a health system. Could you give us an examples or some of the work that you're engaged in? You know, how important is it to have, I mean, particularly now we move towards a digital age. We are seeing the pressures of COVID, for example. How important is it, like, for shared decision making and patient empowerment for the future of healthcare? You know, because we also face huge challenges with staffing in the current system.
Yes. No, definitely, and I agree with everything that's said, and it's also the reason that I'm so glad to be involved here is we cannot do without patient empowerment, and the biggest problem that we currently face are actually the health inequalities that we have. There are huge disparities between hospitals, between geographic regions, between countries. We have the rich nations, we have the more poor nations, and you know, we all deserve access to the best treatment, or at least the care that we need. And there are so much things currently that we need to think, what can we do? Because currently today, it still depends on where you live, which hospital and which doctor you have access to, how your outcome will be. And if we take, for example, a cancer, oncology, so there's big differences even between the diagnosis, the process of diagnosis and treatment within the different hospitals. So if for a patient, you don't have a medical background, if you don't have, you know, your way in the medical network, you're kind of lost. You just go to the hospital in your region, and if we don't work on patient empowerment, you are completely dependent and on your own. And unfortunately, the truth shows that because of the healthcare systems that we build based on basically a one-size-fits-all 70 years ago, when we start developing, you really need to fight to get access to what you need. So what we work on is we work with hospitals around the world, talking how can we integrate the knowledge bases, how can we get the different data types together, how can we solve those healthcare disparities by enhancing collaborations between the professionals, but also how to develop sustainable technologies that both empower physicians to tap into collective information and knowledge from patients and patient cases around the world, but at the same time empower patients to get access in a very simple way based on their specific case, to navigate them to the right place and the right specialist in the system. And that is basically the core priority of everything we do. And yeah, the projects and where we work on in the collaborations is a very broad range. Like I said, it can work between two hospitals, ensuring that if you have, like Mina said, gave the example of twins, but you can also think of an example where you have two small girls with the same tumor, but in two hospitals next to each other. How can we make sure that they both get the treatment that they survive with? But at the other hand, so for example, a few days ago, I connected with our teams in South America, and then in Rio de Janeiro at the moment, and then with COVID, of course, this is only getting worse, the situation. They have now a waiting line of 1,000 cancer patients, and they only have one treatment machine. Machine. So that means that literally many of those patients will die because they need to wait. They cannot do more. So a big part of my work and what I work with my team is also how can we establish smarter collaborations to really work together, both with hospitals, with academia, with the scientists, with industry, to make the system smarter, more intelligent. And if we make it more intelligent, we can make it more efficient. If we can make it more efficient and we can create universal access to information and knowledge, we can help more patients.
Yeah, I think this is this leads very nicely. We'll talk to Juliana about health literacy and the importance of health literacy in order to navigate a system. I mean, what you're describing there is just you know, it's relative to everyone. If anyone gets a diagnosis, to understand, for example, I'm always trying to explain to people, you know, the importance of going to a specialist center Most people say, well, I just want to go to my local hospital, but your outcomes will just dramatically drop if you go to a local hospital. If you have something that needs specialized treatment, you need to go to an academic teaching hospital. And to understand that is very important, and to understand how you navigate that system. I think you're absolutely right around the efficiencies and the system can develop. But if we look at how do we reach that broader context, Juliana, you're working on health literacy. Perhaps you could give us some of the important points of health literacy. What does it mean? Because quite a few people may not understand health literacy, but perhaps you could explain it and its role in shared decision making and empowerment.
Yeah, sure. And to start with, I agree with everything that was said, but I would also like to take a step back and think of health literacy and people empowerment before they are even patient. So empower people to live healthy and to understand the relationships of all their health condition, their health habits, the medication that they take, the disease that they might have or not, and how all those things related can help people stay healthy. So I think health literacy, if we should define it, is not only what people understand, but also what they can evolve into. So for example, we can think about health literacy instead of I understand that I need to eat healthy, but then I understand how I need to eat healthy, what fruits and vegetables I need to consume, if I'm pregnant or if I'm having a disease or if I'm younger. All those parameters need to come into play when we say, okay, how I can eat healthy. So health literacy is understanding first what needs to be done and then having the tools and skills to really implement those changes in the everyday life. So again, we should think about empowerment before, so in prevention, how we can keep people healthy and away from hospital that right now are being so overwhelmed with all the COVID situation. And in this, I would also like to highlight the importance of different technological and digital initiatives and how they help healthcare providers to stay in touch with people in their homes when they are safe and where they can implement all these health life choices. So there are some strategies that show scientific evidence that they work for very simple strategies like teaching patients how to do self-monitoring for blood pressure. Those strategies show a tremendous effect because the patient can see the measures that they take, how they are directly related to the medication that they take and to the healthy lifestyle behavior that they involve. And with only that, just showing the patient how to do a self-measure, at the end of the day, they have better outcomes because they know the strategy that worked for them. They know, oh, I eat this and this, my blood pressure got it high, or I didn't get my medication and my blood pressure got high. So it's just teaching them what they need to know so they can discover the answers that they solve.
Absolutely. And then Manas, from a physician's perspective, can you just tell us really, because it's quite a different way of working, isn't it? From physician, patient comes, I'll tell you what's right. I'll tell you what's happening here. It's, that's my job. I'm the doctor. This is a new way of working, isn't it? In collaboration, co-designing, creating new solutions. I think Suzanne gave a great example where she's talking about colleagues in Brazil and, they've one machine, thousands of patients. It's so important then that those thousands of patients are supported emotionally, but from a physician's point of view, what are the real benefits here of doing it this way?
I think that's a great question. So I think, the benefits are huge, right? But I've drank the Kool-Aid, right? I've drank the shared decision-making Kool-Aid a long time ago. But that speaks to the importance of buy-in from the healthcare team. Humans are status quo beings. We're status quo, we're generally speaking anti-change, right? The 6 people on the screen are outliers, right? Because most people don't like change. When you look at physicians, they are the perfect example of that. We were trained a certain way. We like doing things that work. We like doing things that work in our hands. We don't want to keep learning new stuff because we want to get home by 5. I don't want to be obnoxious about it, but you hear what I'm saying, right? We also have increasing pressures on us, especially, I can't speak in Europe, but speaking to my European colleagues, it's exactly the same. Increasing burdensome regulation, more time spent typing stuff up to meet certain criteria. It's the checkbox approach to practicing medicine, right? It's not personalized at all. It's the antithesis of personalized medicine. That is driven in a large part by reimbursement models and the finances of healthcare. Physicians are no different there, right? So they've got time pressures. So we don't have enough time for each patient to make it personalized, okay? So there's a great opportunity. Talk about decision aids being helpful, giving the patient access to the right information, correct, curated, expert-led, evidence-based content in their own home, on their device, right? That's why I made Breast Advocate for breast cancer patients. That's why Aubrey created My Rabble, right? This is exactly why. That's why Solaviv, right? Mm-hmm. You guys are doing great work too. Everyone's doing great work here, right? So we're all trying to achieve the same thing, and patient empowerment to overcome the obstacles that the physicians face and the healthcare team faces. So varying expertise, right? It's easy for me to get on my soapbox when it comes to breast reconstruction because I perform all the procedures there are. Mm-hmm. I perform microsurgery. I can do all those things. Not everyone offers all the procedures because some reimbursement models prevent them from doing so because they need to pay their mortgage. And are they really going to recommend something that's best for the patient if they don't offer it themselves? Deep down, are their ethics always going to trump what's best in terms of offering an option? I mean, I don't want to point any fingers here, but guys, come on, right? Especially in the US, fee-for-service models, physicians sometimes are fearful of losing the patient if they recommend something that they don't offer, right? That may be better for the patient. So access to all treatment options there are lots of barriers to that. So when you talk about the benefits of shared decision-making as a concept, and then you bring in what others have touched on already on this webinar, improving navigation of healthcare system, healthcare literacy, which is different to e-health, right? Okay, because you've got e-health, which is let's provide them with all the right information, but now we can't presume that people can understand what you're giving them. So we have to do it in the right way, right? So there's that aspect to it. So when you bring all that together as a physician, shared decision-making and the tools that allow us to do it right can actually overcome many obstacles in practicing in today's healthcare environment and pressures, right? Because that's why I made Breast Advocate, right? So now let's look at that patient flow. So again, breast cancer surgery, specifically for breast cancer surgery, we invite patients to download the app before they even come to see us. So they spend however long they feel they need getting all the information, they just researching themselves at their pace before they even come and see me. So now when the patient comes in, I don't need to spend an hour just to go through all the breast cancer surgery options. They already know. And they come in and the conversation goes something like this. So, Mrs. Smith, have you had a chance to look at your options? Yes, I have. I said, okay, well, just in general, here are your, no, let me stop you there, doc. I don't want implants. I read all about them. I'm like, let's just skip that. Here's what I'm more interested in. So now I've just skipped half an hour of the consultation. Now I can zoom in on what's important to her. Well, tell me, Mrs. Smith, why is it you don't want implants? Well, I want boom, 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 boom. And then she tells you what's important to her. And then now that allows you to go down the other algorithm in terms of other treatment options that check her boxes, right? So shared decision making and the aids that we're all working on really provide an opportunity for all of us to provide better care. It's very exciting, very exciting. And especially if we can get the buy-in of healthcare systems. When you look at the studies out there, multi-specialty studies, okay, they improve outcomes. From a value-based model standpoint, shared decision-making is a no-brainer. Patient buy-in improves compliance. It improves patient satisfaction. We all have complications, okay? If you're a surgeon and you don't have complication, you've either never operated, you're delusional, or you're lying, okay? Medicine, we have complications. Unfortunately, we all have to overcome those, right? When you have an educated patient who has buy-in to their treatment plan and things don't go well, because everyone is a great surgeon, a great physician when things go well, right? We're all the best when things go according to plan. It's when things don't, that's when the rubber meets the road. And so you've got buy-in, you've got increased compliance, you've got this feeling of being part of the treatment planning, outcomes are better.
I mean, you've given a great example there, and I know Arjie's keen to jump in, but just before Arjie jumps in, and because I'm going to put a question to everyone here on the panel, is and I was just going to ask Terry just to briefly come in and just say, where do we need to be? You know, what does the future look like? And then I was going to ask, you know, Aubrey and Suzanne and Juliana, you know, from a patient's perspective, what is it we need to see happen to deliver exactly what Manas is talking about, that value-based solution, shall we say?
Value-based solution, where the rubber hits the road when things are going well. I am going to take this opportunity this morning because everybody sitting on this panel has a passion to help patients have a better experience, to help patients have a better shared decision-making experience. We're not the experts here. The experts are us, but it's the people who are joining us this morning, who haven't joined us, who may watch this later, and for those that don't have the opportunity to listen this morning, but should be engaged. I truly believe that when someone is affected by any disease, their whole philosophy changes on how it should be delivered for patient care. Financial investors, people in policy making, thought leaders, we cannot be part of this conversation, I don't think, unless we have felt some impact from a disease. So how do we break down those barriers? And begin talking to each other and saying, look, at some point in your life, you may be affected by disease and you may need a tool to help your condition become better. So that's my call to action this morning. Whoever is listening to this, whether you are a digital healthcare developer, whether you are an investor, a policymaker, a patient, we all have to dump into this pot and share what information we have, and not just share it, but listen to each other. Sit at the table together, break down the barriers in cooperation. Let's just start a new paradigm shift, and let's keep pushing that envelope. Dr. C, you talked about the fact that we become very comfortable with situations, with practice. I think we need to stop doing that. I think we need to get a little bit uncomfortable and really start having some conversations that we are all working cooperatively together to improve our patient care. That's my word this morning.
Yeah, and I totally agree, and I think growth comes from being uncomfortable. And if I come to Aubrey, I mean Aubrey's been waiting patiently there. Aubrey, from your perspective, I think it probably resonates with yourself, your son's diagnosis, and how that's changed, your perception of the health system, and then having to learn and navigate that system. Please join in. I'm really looking forward to hearing your comments.
No, absolutely. And I'll also, I mean, like Terry couldn't agree with you more. And I think that when the frustration part that I saw, and I think Suzanne also brought it up, and I'll bring in the value-based partnerships, there are immense disparities right now in the context of individuals not getting the access that they need, all the way from, and I appreciate Juliana, you highlighting kind of beyond cancer, but everything from, let's say, that initial screening to diagnosis, whatever it is, to treatment, to post-treatment, and what shared decision making brings. And I think what the body of evidence around it shows. And there's a very simple question that we can start asking. And it's, if time becomes short, what's most important to you? Now, we have an opportunity as a healthcare ecosystem to take that answer and to translate it into an appropriate treatment plan, surround sound services, et cetera, around that patient. But if there's supply chain issues, to your point, Suzanne, around, in Rio, cancer patients wanting a treatment and not getting it, then we've got to start rallying around and fixing kind of those bottlenecks. And I think that what we see in the context of improved shared decision making is not only greater satisfaction and an improved patient experience, which helps with compliance on the institution side, which helps with decreased medical risk, with helps with quality on the institution side. But on the payer side, whether it's a government, whether it's private payers, it helps with ensuring appropriate testing so that we're not having unnecessary toxicity, so that we're not having increased hospitalizations, so that if people want to spend their final days at home, that they do so, and we're not having over treatment. So I think that there's a really important economic incentive here, and it's important for the policymakers and for the surrounding body of evidence to really understand how inefficient we're actually thinking about this, because we're not anchored on improving decision making. And I think that there's if you've lived it, you get it, and you want to make that change. And that's why, personally, I felt that there was an opportunity for a consumer platform to help patients connect to their caregivers and distribute the information to equip them. On the other side, certainly there's decision aids for physicians. Why don't we have that for consumers, right? And we have to go beyond Google and Facebook, which 98% of cancer patients and their surrounding, community are actually going to. We know that's misinformation. We know it's not trusted. And we know that there are metrics that we want to see and study to say, can we provide not only equip individuals with the right content, but is it translating into them being able to communicate their preferences, them being able to take a more active and engaged approach within their healthcare? And we can take a very evidence-based approach through technology. And so I would just, offer that I actually believe that there are economic incentives for improving shared decision-making. And we need to Terry's point, really hone in on what that is, bring in the policymakers and show the inefficiencies in the system.
Yeah, look, I think the evidence is there. I think we've stacks of evidence. I think we're at the stage now where we just need to take action. I think we're in a society now, we're moving to a learning society. We need to fail. We need to continuously learn. We need to continuously grow. Suzanne, I mean, you mentioned the words thought leadership and policymakers, and you're in that space. We're working in that space. I'm in it 20 years. I think at this stage now, we really need to see, some action in those, and we need to start putting, we need to let the rubber hit the road, shall we say, and we really need to accelerate this process, because when I look at so many different inefficiencies around healthcare provision, and even if you look at cancer, for example, I mean, I can give multiple examples of where very good people go out with the best intentions and will give equipment that's given to hospitals. But you give the equipment to the hospital, of course they'll accept it, but sure, there's no staff to man the equipment. So I mean, it sits in a corridor, you know. So I mean, they've probably raised £500,000 for that. You know, so we need to start thinking about what we're doing. How do we manage financing? From a thought leadership perspective, from Siemens' perspective going forward, the work you're involved in, what does the future look like, you know, in terms of this area of activity?
Yes. Well, the answer to start with is, I think, actually quite simple. The first question to start with that we can all ask ourselves every day, continuously with what we do, is why do we exist? With the work that we do, why does my company exist? Why do I do the work that I do? Why does it matter? And in healthcare as an industry, the answer is really simple. We're here to help patients, and a step further, we're here to keep people healthy. Yeah, but now we're still having this sick system based on people who are already sick. How can we help as many patients as possible? So, like as mentioned before, whether you work in a hospital, in a company like mine, or as a doctor, as a scientist, as a patient advocate, we all want to help those who need help. So the only thing we need to do is to make sure that we look, what is the problem? What does this person or this group of people need? What is needed to solve it? Who is needed for that? And then, of course, there's always a financial label on it. And that, in collaboration with new models, you can then build, implement, and scale. The point is that we keep facing everywhere is we have built our silos. We don't work together. The main incentive is driven by revenue streams. The revenue streams, the business models, are built on the old context of 70 years ago when we start building the healthcare system, and our new possibilities. So that is the simple thing. Where it becomes more difficult is that this is a multi-dimensional problem. So we need to think, the big enabler in here, we can advocate for everything, and we should do. We need to empower patients. As long as we are in this system, we need to empower as much as possible. But in the same time, we need to work on the technology, because technology is an enabler to improve access to care that patients need, to improve access to information. We need to improve those collaborations, because smarter collaborations means we can do for more patients. And we need to work on different finance models. So, and that is, of course, where the different stakeholders come together. And especially I see the clash in what is possible in science and with innovations and technology versus the finance models. Because as long as new innovations or new structures are not financed, innovators have a hard time to get this implemented at scale. So this is the friction of the current system. But taking that apart, so we all need to work on this. And the main message, we need everyone. But I think also a big learning, and that's a bit me talking as entrepreneur as well, is search the people with a shared vision. And how do you want this future to look like? And then from the different parties, find the people, and then make concrete what you need. And everyone brings something on the table, and then you execute. And then we can accelerate. That's what I truly believe. So I would say from our company perspective, a thing is to work on sustainable technologies, to make sure that we can personalize the healthcare, that we can improve access to advanced care for everyone here and everywhere. And yeah, so that we can do that.
You know, you touch on quite a few points, and it leads really nicely into, I'll bring Juliana in now, and then I'll put a final question to everyone as well around Sustainable Development Goal 3, because I think we've always been looking for a kind of roadmap, a shared vision, and I think it couldn't be clearer. You know, you have 193 heads of state. They've stood up in 2015. They've aligned themselves to the Sustainable Development Goals, and number 3 is good health and well-being. That's crystal clear to me. It doesn't talk about ill health. It talks about good health and well-being. So that is already setting the marker down. It sets the path. So we've got the opportunity to move forward. You touched on many things there around the financing of all this. And I think this is where we find real challenges at the moment. Because, I mean, I was listening to, Irish financial services talking about investing in green energy and, over the last couple of days. And I'm interacting with investors all the time, or banks or whatever it is. And they all talk about, there's enormous capital, there's savings there, there's investment to be made. It can be leveraged here, it can be leveraged there. But when you actually go and say, well, okay, let's do this, how do we get it? It seems to bottleneck up. It seems to find there's a sticking point. There's, like all of us here, we're all trying to do the good work. We're trying to get that momentum, but there just seems to be that final nudge that needs to get us over that line. Juliana, if I come to you, let's look at good health and well-being, SDG 3. In terms of patient empowerment, the future of healthcare, where do you see this going in the next 12 to 36 months? What would you like to see happen? And I'm going to put that question to everyone, and then we'll close it up because we'll be on the hour at that stage. So, Juliana?
Yeah, so I think that taking back from what Minas was saying, Susan and Audrey, we are leaving always the healthcare providers very alone in this model. So they have a big responsibility to explaining the patients, to explaining everything, and also to delivering the treatments, and also to following them up. So they are alone in this whole process. And we need our system to start working more integrative with other healthcare providers and also with other people that can help. And they are not healthcare providers as such, maybe social workers that can help people understand the meaning of things. There are also a lot of administrative work that patients need to do when they receive a diagnostics. For example, when a person receives a diagnostic of cancer, and the first thing, it happened recently in my family, the first thing is, who is going to take care of so many paperwork? And then the doctor is also there in the middle trying to help the patient with all the paperwork and trying to explain, and the patient is worried about everything, and they don't have the mind to concentrate on what really matters, that is taking the right decision for them and understanding other possibilities that they have. So I think that we need to work on a model, and it could be great to start constructing the model that the healthcare provider, the doctor, is the one that should know everything, and that should be the only one providing health to the patient. That is a combined system. There is administrative work that can be helped. An administrative person can help the patients to understand. There is people, social workers, that can increase people health literacy by helping them understanding the content that they are receiving. So it would be great that we start constructing this model that we have.
This is great. I mean, so let's just go to Terry here, because this new model, this new way of working, I think you've already started that with your foundation. Tell us a little bit about that, because that's promoting good health and well-being. You have established that community. How can we get that shared learning going forward? I mean, I think this is what the future looks like. It's that experience. How do we scale it?
Yeah, I think it comes with a great deal of responsibility, because curating a nonprofit foundation by providing the best in resources and curating a community, an online community, to really share the important things that are missing. I'm going to wrap this up with a question this morning. What is it? What is it on this panel? What is it for any viewers that watch this? What are the missing pieces in the puzzle that are stopping us from empowering patients, from really engaging in shared decision making? And I'm asking patients that question. I'm asking industry that question. I'm asking policymakers that question, and I'm asking financial people that question, who are going to support all of this work and can support it. Mm-hmm. Because if we if we ask that question of each other and listen, then we can move forward with, breaking down the barriers of health disparity. They're huge. But what's the missing piece? What are the missing pieces that people need help with? And there's health disparities in my country, in the United States. I talked to a man in Kenya a couple of weeks ago. There's health disparities there. They're everywhere. What are our expectations in each of those areas, and how can we help people? We've got to ask the questions, and we've got to share the questions and then listen to each other as we respond to those and what we can provide for each other.
So, I mean, these are great points, great questions. Manas, just an answer there. How do we help and support? Terry's put a very valid question to us. Where do you see us being able to leverage policy towards this?
Well, I think, policy, I think, comes, it's hand in hand with finances, Gareth. Mm-hmm. Without money, I don't think policy is even on the table, right? So I think the wonderful work that WHIS is doing, you look at SDG 3, all the projects that we're looking at, the groups that you're heading up and putting together, really provides, tech, digital aids, all sorts of tech, really, to put shared decision making really at the core as the driving philosophy behind all things healthcare moving forward. I mean, mm-hmm. It's the most ethical approach to healthcare delivery. It's the most cost efficient approach to healthcare delivery. Empowers patients and improves outcomes. Right. So that's where it is. I think the policy comes when you secure the finances.
And I think this is a really interesting one, because I had a discussion this morning with a very large public body this morning. I won't name them, but a huge institution this morning. Everyone would know who they are if I mentioned them. One of the largest healthcare providers in the world and leading ones. And we were discussing, and I had a chat about, what we were doing, how we were supporting sustainable development goals. And I explained to them the huge opportunity. Now, if you take, for example, Siemens, or you take other technology companies around the world, their whole business model is based on intellectual capital. It's based on intangible assets. And you've seen how valuable they are if you take Apple, for example, or any of these huge tech companies. But I think now is when we talk, Suzanne, and, we were talking earlier, Suzanne was talking about, this change of bringing those groups of people together, and we need to think differently. People need to have to start to think, okay, well, how has things been financed, for example? And the question I put to everyone I had a group session this morning, 4 very senior managers, very senior leaders. And I asked them a very simple question, was, where is their pension fund? Okay, so where is their pension? Where is it spent? None of them could tell me. And I had said to them, do you not think it would make sense to put some of that pension fund into sustainable development goals so that we could trial these things? And they all were looking at me saying, yeah, so we need to have those conversations, so we need to, and I think we need to, in the thought leadership space, which is, global influencing, policy making, we need to broaden that discussion, around the economic value of good health and well-being. What does that mean? And Suzanne, I would like to ask, how do we go about leveraging that? Like you mentioned, you 70,000 employees in your space. How do we make that? How do we amplify that?
Excellent question, and actually refer back to my answer earlier. It's always the high level abstract conversations that you also pointed to, but together define your specific goal and then bring together. So and that is that entrepreneurial spirit again. Big vision, start small, but do that smart, and that you do together, because otherwise alone no one comes through all the barriers that we have, because we're talking system change. So by working together with the right partners, with the same incentives, starting from the start with this defined goal, everyone knows where he or she is responsible for, and then you make it happen. And then you start small, but you have the ingredients to rapidly implement and scale up. So that's kind of the trick. And that applies for business, that as a tech company, but that applies everywhere. I'm also in the board of the National Healthcare Institute in the Netherlands, and we're having similar conversations about this. That's also part guidelines. Let's stop making guidelines. Let's stop focusing on the perfect technology, the perfect services. Really, what is the goal? And bring it to patients, learn along the way, but start.
So starting action, Aubrey. What I want to try and do is give us some of your thoughts on how we start. And then what I want to do quickly is get 30 seconds finally from everyone on their final words for everyone listening in here. So Aubrey, off you go. How do we get started?
Yeah, I'll make it snappy. So a few things. Could not agree more. We are obviously all change agents. We need to start small, identify what's working. We have a broad vision. We need to start small, identify what's working, and amplify that, right? So appreciate the mission, but let's really take a metrics-driven approach to say, are we creating the change, in a pilot city that we are intending? Learn from that and then scale from there. When we talk about the finances, I think we all kind of see the vision. To Minas's point, we have the Kool-Aid. The question is the status quo good enough? Is the rate at which people aren't getting access good enough? Right?
Yes.
And I think that there's an economic, certainly with the entire global world has seen what poor health, what a pandemic actually starts costing. So if we want to talk numbers, I think the question actually is right now good enough? Like, these are the numbers of what's happening, right?
Absolutely.
And it's not good enough. There is a way to actually short circuit and democratize information and access for all. And we need to find those pilots, learn from them, and scale it appropriately. But there are economic incentives. There's economic alignment to be able to do that, right? And I think that there's just, I think that, it's not just good health, it's avoiding poor health, right? And it's really ensuring that we're very clear around how we're able to create local economies by improving the health of the population. I know we have 3 minutes left, so I'll pass it back to you.
Absolutely. No, I totally agree with you. And I mean, the cost of COVID is into the trillions. So really quickly, Juliana, last word from yourself on the session. Patient empowerment, shared decision making. Are you optimistic for the future?
Yeah, and I would like all of us to think about how are we going to measure in the future that we are really succeeding to meeting our goal. Like, are we measuring in less readmissions? Are we measuring in healthier populations? Are we measuring in less hospitalizations? Like, what are the metrics that we need to take into consideration to know that we are meeting our goal?
Good questions. Suzanne, next up, final words.
My dream is just a future where every patient has access to the care they need.
Okay, brilliant. That's a nice way to round off. And Terry?
If you were sitting in my classroom today, I would look at all of you and say, if you have a question, if you don't understand something, if something is not working for you right now, raise your hand and don't be afraid to ask the question. That includes everybody.
Brilliant. Manas, fear normally holds us back. Do you see a fearful future, or is it an optimistic one?
I'm very optimistic. It's an opportunity, Gareth. Huge opportunity. And as my final word, I would like to implore, if any physicians, healthcare systems watching this, clinics, get to know shared decision making. Look at the concept. It's super simple. It will make your patients happier. It can save you money, and it can make your patients do better, improve your outcomes. It's a no-brainer. Please look at shared decision making as a core value moving forward in your institutions.
Fantastic. And this leads us right up to 60 minutes. So it's just been a fantastic session. Just some final words, just to thank, everyone who's joined the panel today, anyone who's listening to this on recording, anyone who wants to get in touch. It's WHIS.world is the website. I'm sure you can contact all the speakers here. We're all available on LinkedIn and Twitter and social media. I just want to thank everyone for tuning in, taking the time, and we look forward to sharing more insights on the future of healthcare and how we can deliver the Sustainable Development Goals. So we'll close off. I hope you've enjoyed the session, and I'll end this broadcast. Thanks, everyone, and bye-bye.
Thank you so much.